In the sixth episode of a six-part series with Delaware Life Marketing, Val Sender, Associate Director, and Jeng Chiu, Vice President of National Sales Consulting, discuss what financial advisors need to know about Medicare, including eligibility, enrollment, and coverage. So welcome to the podcast, Val.
Thanks, Bob. Thanks very much for having me again.
It's a pleasure to have you back. Now, for the benefit of our listeners who may not have heard your previous podcast, do you mind giving us a brief overview of your background and role?
Sure. Happy to do that. So I'm with Delaware Life, and I specialize in the topic of Social Security and Medicare. And Medicare is something we want to talk about today.
Great. Yeah. So we have lots to cover in our discussion about Medicare. The common question I think that you get asked by financial advisors is who's eligible and how do you plan for healthcare costs in retirement?
Sure. That's one of the questions that comes up quite a bit. And the way I try to always position that is we all know that we need healthcare in retirement, and Medicare is that path to healthcare. And what do we need to do as financial professionals or as individuals or beneficiaries of Medicare? What do we need to do in order to plan for any of the expenses that come with Medicare? Because Medicare and healthcare, as we know, in retirement is not free. So whoever becomes eligible, the easiest way to memorize that is age 65. At age 65, a person becomes eligible, and it's based on Medicare payments that one makes or does into Social Security over their, let's say, 40 quarters or 10-year working years when the eligibility becomes available for anybody.
Yeah, that's great. And sometimes people mistake the fact that you might claim Social Security full retirement age is 67, but Medicare is always 65.
Correct. On the flip side of that, I had a situation where a person was claiming Social Security early at 62, and they thought they could also get on Medicare at 62, and unfortunately, that's not the case.
That is not the case. So a lot of people who are working might have the ability to contribute to a health savings account, and there's some sticky rules when it comes to contributing and enrolling in Medicare. Tell us about that.
Right. So there is a percentage of folks that participate in health savings accounts on high deductible health insurance plans, and Medicare doesn't really play with that. So whoever is eligible is applying for Medicare. In order to avoid any mishaps or penalties, it's best to really stop contributing to any HSA about 6 months prior to the official start date of Medicare, because Medicare depends on the filing rule or filing time. Medicare has that 6 months back rule. So if somebody continues to contribute, that would conflict with the Medicare eligibility, and there'll be some penalties based on that.
Right. So just a quick question around that. If someone is working past age 65 but doesn't enroll in Medicare, they still have the opportunity to contribute to an HSA?
That is the case, yes. There could be a situation where somebody is working for an employer. An employer has to be 20 employees or more, because it has to be the creditable coverage for Medicare purposes. The coverage has to be as good or better than the actual Medicare. But technically speaking, at 65, if somebody continues to work, they don't have to sign up for Medicare. Most of the times, Part A is free of charge. There is no premium for it, so that becomes that could be that somebody could apply for that one with no issues. However, the Part B does have a monthly premium, so why pay a premium to a current employer and also pay for the premium for the Part B? So probably deny Part B in that situation.
Right. So we talked about HSAs before someone goes on Medicare. There's a unique feature about HSAs being able to use the money for qualified medical expenses, but among those qualified medical expenses are some having to do with Medicare premiums. Is that right?
Yes. So for HSA, if somebody had contributed to HSA, this pool of assets accumulated in there, any kind of a healthcare expense is I call it a free game. Anything can be paid from that account, including some of the expenses Medicare related, with the exception of one of the Medicare supplemental plans, the Medigap plans. Those premiums for those plans are not eligible to be paid through HSA monies.
So if you had a Medicare Advantage plan or Part D expense, or even IRMA charges, perhaps.
Correct.
Yeah. So let's talk a little bit about enrolling. There are a lot of people who are continuing to work past age 65. They might have employer-sponsored health plans at work, and they're grappling with the question of, what if I keep working past age 65 and have a health plan at work? Do I still need to enroll in Medicare?
Yeah, so if somebody is working for a large employer and they have an active employment and the creditable coverage, they don't technically need to apply for Medicare. Then Medicare would become a secondary plan. The employee plan will become a primary plan. When the employment ends or when the healthcare coverage ends, that's when the person would need to apply for Medicare officially. Again, Part A comes in with no premium. So technically speaking, that's okay to carry through, including while being employed. Part B does come with a premium, so probably best to look at, and why pay two premiums into two plans if I don't need to. Once the employment ends, that's when the person would become eligible to apply for Part B, and they can start Part B with no problem. Again, the timing would be crucial because we don't want to have any gaps in coverage, and Part B also could come with some potential late enrollment penalties, so we have to be very careful about that.
Right. You also get a lot of questions about how to combine Medicare with other types of healthcare plans like that offered by the military, TRICARE perhaps, and other programs. What do folks need to know about that?
Again, they would have to be compatible or as good as Medicare. So some of them will come with a prior employment. For example, I've dealt with a few places where teachers are being offered some kind of a healthcare plan in retirement. Similarly happens with military folks. You know, those plans in the end are not guaranteed. If the plan decides to terminate, or if the former employer decides not to offer the healthcare plan anymore, that's when a person needs to get back on Medicare. And because in that case it was not an active employment, but the retirement type healthcare plan, it could be viewed by Medicare that it was not creditable, which means it wasn't as good as Medicare requires. And that's where the late enrollment penalties for Part B and Part D could come into a conversation.
Right.
So it's best really to, if there is such a situation, HR or the benefits group should be able to answer these questions by the employer to ensure everything is compatible.
Yeah. So for advisors who may not have sort of working knowledge of these terms, Medicare and Medicaid, sometimes people think they're one and the same, but they're not. Is that right?
They are not. You know, they're really distinct, and there is a lot of confusion because Medicare comes in with different parts of Medicare. I'll just say there is Part A and Part B. And what does this really mean? What does it really cover? There's also a Part C. What does that mean? And there's also a Part D. What is that? And there's also that Medigap. So I call Medicare really as entering maybe, two separate rooms, if you will. One room has the traditional Medicare or the original Medicare, which is A and B. That's what was initially offered by the government. 1965 was the first launch of Medicare. And it covers, Part A covers all expenses hospital related. He has to be an inpatient admitted person, not in a hospital for an observation, but he needs to be admitted as an inpatient. And then Part A covers that. Part B, on the other hand, covers all the doctor bills, outpatient services, durable medical equipment, and some procedural things like medicines or shots, for example, that has to be administered in the office and not over-the-counter medicines type thing. So that's Part A and Part B. There are some copays and coinsurance for both. There is no premium for A, but there is a premium for B. I believe $233 for the whole year for Part B. So that's something to keep in mind. Part A and Part B. Part B becomes really 80-20 type coverage. So the Part B will cover 80% of the expense, and then the patient is responsible for the other 20%. So if there's a large procedure in the hospital doctor's office that's expensive, the person is on the hook for that Part B cost, 20% of that. Right. So that's what we have in the original. In the same room, then we can also find some other ways to supplement some of those gaps, if you will, that Part A and Part B comes with, some of the extra costs. And that's where the Medigap plans could come into a conversation, also known as maybe supplemental plans. And they are also abbreviated by letters, alphabet letters, A, B, C, and so on. However, these are called plans. The other ones are called parts, Part A and Part B, Part C, Part D. These ones are called plans, Plan A, Plan B, et cetera, et cetera. So they fill in some of the gaps that original Medicare does not cover. So it's not a health insurance plan, but it's really a payment plan to cover for some of the expenses that A and B don't cover anymore. Now, I mentioned A, B, and I mentioned Medigap. Well, what about medicines? What about over-the-counter medicines we need to get? So none of those A, B, and Medigap come with medicine. So now I also have to purchase Part D. D stands for drugs. So this is for over-the-counter medicines type thing. So really, I need to look at Part A and Part B, supplement with the Medigap, and then Part D for medicines. So really, I'm looking at maybe 3-4 different types of Medicare coverage in this one room. And then on the other hand, we have that other room, and that's where we would find Part C, Medicare Advantage, also known as Part C. It has to be as good and cover what Part A and Part B covers. Oftentimes it comes in with a drug plan, but there'll be only one drug plan. So make sure the person who is selecting, they got to select the right one that fits them for what they use for medicines. And oftentimes they don't come with any premium. Sometimes they don't come with any premium. So that could be a benefit. If somebody is in a perfect health, they don't ever have to go to the doctor, to the hospital, do anything. They don't have to pay any premiums. The health can be very inexpensive that way. Whereas the other ones I have to pay, I have to make the monthly premiums for Part B, Part D. The couple of drawbacks with that is that original Medicare with the Medigap and Part D. Part D, by the way, a beneficiary can really select any plan. It's not one plan, but any plan that's in that zip code where the person lives. And whatever is the most suitable for their drug formularies, they can pick and choose whatever they like. The benefit of that plan is the person can go to any doctor, no referrals anywhere in a country. So if I want to go to a special, I don't know, cancer treatment somewhere from state to state, that's entirely possible. No requirements there. Whereas Medicare Advantage, the Part C, that we can think of as the traditional HMO type healthcare. I got to have the primary care provider, my primary doctor, and I have to get a referral to go to the specialist. I have to go to the network, so I have to stay in a network. It has become a little bit more flexible, but still it doesn't really travel well across the country. If somebody wants to winter in Florida but live in Wisconsin, that's something to keep in mind.
Right. So many follow-up questions, Val, one of which has to do with Medicare Advantage plans or even original Medicare. Many people are under the impression that it also covers vision, hearing, dental. Any thoughts about that?
So the original does not cover the routine, what you would expect, old age illnesses, the routine dental care, vision, hearing, foot care. It doesn't cover any of that. So that's something that a person would have to look outside of the plan and purchase something in the open market.
Right.
It does cover obviously surgery. Somebody needs to have an eye surgery, cataract surgery will cover that. Dental surgeries will cover that, but the routine stuff is not covered.
Right. Now, some Medicare Advantage plans do offer that, but perhaps they come with a premium, whereas many come with no premiums.
Correct. Some Medicare Advantage will cover that. There are some limitations. It's not, 100% coverage of it, even though, sometimes when I see ads on TV, you would make you believe that it's 100% coverage. It's not, but they are becoming a lot more flexible in trying to offer, the bundled services all in one plan.
Right. And then we've talked about the Part B premium being, I think, $170.10 for 2022. That fee rises each year. But there's also an additional surcharge if your taxable income is above certain thresholds called the income-related monthly adjustment amount. What do folks need to know about that?
Yes, that IRMA. So I always forget this abbreviation. I always got to stop and think, what does this really stand for? but it's basically an additional payment based on the income level that a person has from 2 years ago. So Medicare will take a 2-year look back, look at the income level either as an individual or joint, and then the premium will be determined that way. So the actual premium for Part B for 2022 is $233, and it's an annual premium. And then in addition to that, there's also a monthly premium for Part B, the monthly payment for Part B. The lowest is at $170.10. Yes, $170.10.
Right.
I'm sorry, 233 is a deductible, not a premium, but a deductible.
Right. So a lot of times people might be, because of the 2-year look back, maybe they retire at 63, they get a bonus, maybe they've done a Roth conversion, or maybe they've sold a lot of stock or a home, and it's above the exclusion amount, and it triggers IRMA at age 65, and they're caught by surprise. Any thoughts about how people can plan to avoid these surprises?
Probably do all these financial transactions before they apply for Medicare, but any of that would actually count towards that income. There are some exclusions to it based on, life-changing event, but, selling real estate or liquidating a particular asset that generates income, it would still come as that income. It's based on the modified adjusted gross income, the MAGI or MAGI. So that would count.
Right. And there certainly are ways to appeal the premium surcharge, right, because of some circumstances, death, et cetera, et cetera.
Correct.
Yeah.
Death, divorce, change of jobs, layoff, things like that.
Right.
Basically some hardship.
Yeah. A big thing in the news today is the topic of pre-existing conditions. And sometimes people think that they could be denied Medicare for having a pre-existing condition.
They cannot. They are eligible. The pre-existing conditions do not disqualify anybody from applying for Medicare, which also would include the Medigap plans, which somebody can find beneficial. When there's an initial enrollment period for Medigap plan, it's a guaranteed issue, age 65, I believe age 65, and then 5 months after that.
Mm-hmm.
However, after that, there will be a medical underwriting if somebody were to get on it later on. However, the original Medicare and Medicare Advantage does not disqualify based on pre-existing conditions. So there are some really great options for folks to have in any of these plans. So it's a terrific opportunity.
Right. I mean, I've heard of tactics where people who are anticipating pre-existing conditions sign up for original Medicare and Medigap. And sometimes, as you well know, that you can switch back and forth between original and Medicare Advantage during special enrollment periods each year.
That's possible. Yeah, that's possible.
Right, but as you mentioned, if you don't enroll in original in Medigap right from the get-go, and you develop a pre-existing condition and you're on Medicare Advantage, there's a possibility because of the medical underwriting you might be
Correct.
denied. Right?
Correct.
Yeah, so people have to be very careful about that.
Correct. The Medigap and Medicare Advantage, that Part C, are offered by private insurance companies. So is Part D. So it's not as free as it would be selecting Medicare Advantage or original Medicare. So there are some restrictions after that.
Right. A lot of times people think that if they enroll in Medicare, that their spouse will be enrolled as well. Any thoughts about that?
Yes, that's a big one, because folks are familiar with employer healthcare plan. I'm on it, my spouse is on it, and they think it's the same way for Medicare. Unfortunately, it is not. And Medicare is an individual plan. So the husband has to get his, and then the wife has to get hers. And the good thing is about it, though, if, for example, if the wife didn't work enough credit hours or enough years and paid into the Medicare, she can qualify on Medicare based on her husband's record, and vice versa. But it's still, all of the expenses here are on individual basis. They are not based as a family. So that's something I always say, we all need healthcare, and in retirement, that healthcare is not getting any cheaper; it's getting more expensive. So how do we need to plan? What vehicles, what investment vehicles we need to employ in order to cover these monthly expenses or healthcare expenses, long-term care expenses, right? It does not cover Medicare. Any of the Medicare plans or parts really cover long-term care insurance. So that's completely separate.
Right.
And how do we structure that income for 20, 25, 30 years that no matter what happens, I know I can seek help for my health. Otherwise, I pay with my health, but for not going to the doctor, and I let my health deteriorate. So that's a key question. We all need health insurance. We all need coverage, but how do we plan through investments and income to cover these expenses?
Right. You mentioned long-term care. Medicare doesn't also cover nursing homes, except for maybe in special circumstances where you're being discharged from the hospital into a skilled nursing facility for 99 days, is it, I think?
That is correct. I believe it covers first 20 at zero cost, and then there's some kind of a payment after that. He has to be a 3-day inpatient state in the hospital and not including the day of discharge. And then the patient needs to be discharged directly to the nursing home. And there are some benefits coverage for that.
Yeah.
It's zero cost from the first 20 days. There's no cost, and after that, I think it goes to like something close to like $200 per day. Days 21 to 100, if I remember correctly, something like that.
So it's all very confusing to the advisor who might be advising clients around enrolling in Medicare, healthcare costs in retirement. Any thoughts about where folks could go for help? I know oftentimes they're told to go visit their local senior center and visit the local called SHIP, right? The state health insurance programs that are in different towns. A lot of people are wary of perhaps or eager to find unbiased advisors who could help them determine whether to go into Advantage or Original or which Medigap plan to pick. Any thoughts about where to go get help and who to trust?
Yes, it's definitely a trust situation, right? And I always call Social Security making the right choice, because usually once it's made, it's pretty much ready, set, go, and it cannot be undone. However, Medicare, I call it knowing the right choice, because we might have to change it from year to year depending on how the plans change. One of the places to really go for initial help would be Medicare.gov website. And based on a zip code, a beneficiary can look up and see what's available in their zip code, because it's available by zip code. It's run by the federal, by the Fed, but it's really on a state level. And one zip code may have, let's say, 10 plans of some sort, and another zip code may have 20 plans in the same category. So it's depending on a zip code. That's what I would suggest as a first thing to go and look at and select, see what's available, how many, and what they cover. And another spot would be that SHIP in Massachusetts, where I am, is actually called Shine, and it's a free service, and it's supposed to be an unbiased service. So there's nobody with any interest to sell any particular product, any particular benefit. And this is also a good way to get a better understanding about what's going on and seek some directions, how best to go about it, because it is confusing. We just had one of our folks retire from our company, and I'm in contact with that person, and he said it was very, very challenging.
It is challenging.
And that's somebody from the financial services industry.
So what's your best advice to an advisor who wants to add value to the relationship, but also wants to avoid getting into trouble, perhaps with their compliance department? Maybe they don't have a health insurance license, perhaps, but they want to do right by their client.
Yeah, that's a good one. That's a good question. I think one is really just to educate know where to go for resources to help anybody, any particular client with any of these questions, health related, because it's very personal. So I think getting a better knowledge, better understanding what these different terms mean in terms of Medicare, what's covered and what isn't covered, and then just network with folks that actually offer these services. Including going on any particular, like I mentioned, Medicare.gov or any of the healthcare providers or insurance providers' websites and see what they have available in there as well. But I think that's probably the best way to really approach it. Get really knowledgeable, learn as much as possible on this, and then help clients plan for that.
Yeah. And this is an ongoing thing now, right? I mean, because each and every year, like you said, the plans change, the formularies change, the doctor network changes, the premiums change, et cetera, et cetera, et cetera. This is not a set it and forget it process here.
Yeah, without a doubt, it's something to keep in mind. I don't know if it's on an annual basis, but at least every couple of years, because if somebody's on an expensive medicine, for example, in Part D, and that medicine gets dropped the following year, and it's no longer covered, then that person is going to be too responsible for that medicine 100% because it's not covered. So usually towards the end of the year, plans announce their formularies, what they're going to have available for the following year. So if somebody's taking lots of medicines, it's best to really familiarize themselves to see if those are still available. And if they aren't, they can change from plan to plan during the annual enrollment period.
Right. And if I'm not mistaken, I believe Delaware has on its website resources related to Social Security and other retirement income related topics.
We do, yes. And we always make ourselves available. And if we don't know the answers, sometimes it's hard to know all the answers because they could be very specific. We seek other resources to really guide the clients or guide the advisors to get the best answers.
And they can reach that website is where again? Remind me.
We are at www.delawarelife.com, delawarelife.com.
Right. So Val, we've covered a lot of ground. Anything we missed or anything that bears repeating?
There's a lot there. I think we've covered a lot of stuff. I think it would take us another hour and a half to go through all the details in terms of costs and how to plan for it, what these really different terms mean in greater detail. But I think this is a pretty good info up front, and if there are any additional questions, we're happy to answer.
All right. Well, Val, I want to thank you and all your colleagues who've participated in this six-part series.
Wow, okay.
And I would encourage folks, if this is the first of the 6 that you've listened to, that you go back and listen to the previous 5 podcasts that we've done with Delaware. They're chock full of great information about all kinds of topics, from estate planning to Social Security and Roth IRAs and whatnot. So we're especially grateful for you and your colleagues sharing your knowledge and wisdom with our listeners.
Wow, that's awesome. That's a great opportunity. Well, thanks for having us, Bob. It's really terrific. We're happy to share anything that we know so folks become more educated, better educated, and have other resources to go and they can seek some help.
Thank you for listening to the Exceptional Advisor podcast, brought to you by the Investments and Wealth Institute. If you've enjoyed this podcast, please subscribe through iTunes, Spotify, or our website at www.investmentsandwealth.org/podcast to get the latest episodes of our Exceptional Advisor podcast series. For additional resources, updates on events, and exclusive membership deals, visit www.investmentsandwealth.org.